All right, the next piece, and it, as promised, is about our Team Kentucky Fund. So many folks that have been coming together to try to help their fellow human being. And we have a special guest that we're going to bring in by Skype to talk us through what we're doing. Hello, Jacqueline.
Hello, Governor. Hello, Team Kentucky. I hope everyone is doing well, staying healthy at home tonight. I have some great news to share with the state about the Team Kentucky Fund. First of all, I have recruited 5 co-chairs to serve as the team that leads the charge here, and it is a bipartisan group of folks that you might recognize because they have all held my position as Lieutenant Governor in the past. So our co-chairs are Jerry Abramson, Steve Henry, Crit Llewellyn, Steve Pence, and Dan Mongiardo. A second exciting announcement is that we are going to be partnering with Community Action of Kentucky. And we're going to be partnering with this group because they have a long history of impactful work. And this organization is going to serve as the hands and feet of this mission. We will have an application process that will be released in the coming days, and we are working really diligently to make sure that the Team Kentucky Fund is well organized, accessible, and equitable to all Kentuckians on Team Kentucky.
All right, Jacqueline, we appreciate your work. To date, we have raised $1.9 million to the Team Kentucky Fund. More than 7,000 people have donated. Most of the donations were less than $100. We've also had some businesses and private donors step up with gifts from $10,000 to the $1 million announcement we had from the Kentucky Colonels just yesterday. So a couple of different things, the folks that have contributed. Health Tech Solutions, we appreciate your $25,000. We had the Lexington Bluegrass Association of Realtors give $50,000 today. LG&E came through with $100,000 for us. And Brett Walker and Emily Stites, in cooperation with Teespring Inc., who are operating BashirGear.com, have already generated $65,000 for the fund. Jacqueline, you want to talk about some of the ways this money may be spent, rent, and other utility help?
Yes. So the Community Action of Kentucky has a system already in place where they support our fellow Kentuckians through uses like rent and mortgage, utilities, and food and groceries for folks who need it. So that is the work that we will continue to do, and we will luckily be able to take these funds and expand it even further to every corner of Kentucky.
I want to thank everybody for their generosity in this because nobody's personal finances are in a positive place as we go through this. And thinking about the fact that people would donate already $1.9 million to help out their fellow human being is once again passing that test of humanity. Thank you, Jacqueline.
Thank you, Governor.
All right. So now we're going to move into the numbers for today. And the numbers for today are going to be a little different. We are moving into a new reporting system where we don't have all of the data from today in. Our hope is that the new system, which is updated, allows us to have some more accurate data as we go. So today, and this number is understated, we have 88 new cases of the coronavirus, and when you remove duplicates and others, our total number is 2,291. We know there are at least 50 cases, 50 positives that came in today that haven't been imported into this number. So we know it is significantly higher. New cases by county are 11 from Davis, 7 from Hopkins, 7 from Jefferson, 6 from Boone, 4 from Callaway, Campbell, and Graves, 3 from Jackson, 2 from Adair, Carter, Christian, Fayette, Garrett, Grant, Kenton, Muhlenberg, Oldham, Shelby, Todd, and Warren, and then 1 from Allen, Ballard, Bracken, Breckenridge, Bullitt, Butler, Floyd, Hardin, Laurel, Lincoln, Marion, McCracken, Pike, Rockcastle, Webster, and Woodford. So what we know is that we are still in that escalation, and that is absolutely everywhere. We have tested at least 28,324 Kentuckians. 807 have ever been hospitalized. 412 are currently hospitalized. Let's be thinking about those 412 people tonight. 367 have ever been in the ICU. And folks, we have 252 people currently in the ICU. That's an intensive care unit. That's the most people that we have ever had in the ICU at one time. So know that Kentuckians out there are in harm's way, and we are doing everything we can, and our hospitals are, to help them. Here's the great news today. We have 862 Kentuckians that we can confirm have recovered. That number has jumped a bunch, meaning a bunch of people have gotten better, and so we are really excited about that. And I don't know, on the broadcast, there's some noise in the background. We do have some folks up here in Kentucky today, and everybody should be able to express their opinion that believes we should reopen Kentucky immediately right now. Folks, that would kill people. It would absolutely kill people. We know we're not to that point. Even New York, with what they've been through, is not to that point. So my job isn't to make the popular decision, but the right decision, and the decision that saves people's lives. Because today we've got a report that we have lost 7 more people to the coronavirus. 7 Kentuckians who are loved by their families, who are loved by their communities. These 7 people are a loss to all of us, so let's make sure that we light our houses up green tonight, our places of business. Let's make sure that we ring our bells at 10 a.m. tomorrow. 7 Kentuckians that, added to everything else, are 122 deaths related to this coronavirus thus far. How it breaks down is a 93-year-old female from Jefferson, 65-year-old male we don't have a county on at the moment, a 48-year-old male in Simpson County, an 88-year-old female in Jefferson, a 93-year-old female in Jefferson, a 94-year-old female from Hopkins, and an 89-year-old female from Jefferson County. Again, those are 6 folks. Hopkins has been hit again, and I know how hard it has been for them. So to all the families that are out there, we care very much about you. How the racial and ethnicity breakdown to total cases. We have 74% of all cases, the data on races. It is 80.62% white, 11.63% black or African American, 2.68% Asian, and 4.93% multiracial. Ethnicity of overall cases, we know 66%, 93.41% non-Hispanic, 6.59% Hispanic. Our death rate continues to be really problematic, especially when we look at the racial breakdown. And we've been on calls today, and we're working on some plans to do what we can to address this. It's based on hundreds of years of inequality and healthcare inequality, but that doesn't mean that we shouldn't do everything we can to address it right now. So of the racial breakdown on deaths, we know 82%. Of that, 77% white, 22% black or African American, 1% Asian. And as we go to the ethnicity, 98.99% of deaths have been non-Hispanic and 1% have been Hispanic. So again, those are some concerning numbers. Just like all these numbers we face are concerning. So again, remember, to everybody out there that's lost somebody today, or has somebody in the ICU, or has somebody in the hospital, or who is otherwise in a hospital bed, let's send all of our thoughts and our prayers to them. And let's remember that every time we reduce our contacts and all the sacrifices that we're making, whether it's not going to work, whether it's not going to a crowd, whether it's not engaging in a mass gathering, what you are doing is saving lives. All right, we'll move into questions now. We have, I think, 4 of our reporters here. We have Phil Pendleton, Joe Ragusa, Joe Sanka, and Mike Valente. And I think I made you go last time, didn't I, Joe? All right, we'll start you off first.
I hope you can hear me over.
I can hear you.
But I wanted to ask you about those protesters. They were talking about telling businesses to open back up in defiance of your orders, and you have to stay here outside. What's your message to them?
Well, the question's about some protesters that are here today in the Capitol. They want businesses reopened immediately, and that would cause the death of more Kentuckians. Listen, Kentuckians out there are noble and have engaged in this sacrifice, understand what's on the line, and want to protect everybody else out there. And remember, we're following the White House guidelines. The White House guidelines have asked us to take the steps that we have made, even though we made them oftentimes a little bit earlier in this. We're in conformance with the suggestions not only of the White House, but of our neighbors. We talk about Ohio and Indiana that are led by governors from different parties. There is not partisanship in this. It's just us doing what it takes to protect people. And it's a fact, an absolute fact, that this virus spreads quickly and is deadly. And all you have to do is take a look at the numbers today, especially in our nursing home facilities. We could put those up. I didn't do this update, but in our long-term care facilities, just today we're reporting an additional 39 total cases. That's 10 more staff. It's 39 more residents, 10 more staff, and 3 more deaths. So every time that there's an opportunity for more contacts, every time that people engage in a mass gathering, what happens is it's more likely that this gets into our nursing homes where people have been really harmed. This is where the virus comes. This is who it comes for, and we've got to do everything we can to protect them. I think I heard that at least one legislator today said we should open up visitations in our nursing homes. I mean, that would ravage them. That is a very dangerous suggestion. While we're doing this, let's show the Green River Correctional Complex. I believe we have 6 additional cases to report, 2 more inmates, 4 more staff. It's why we're taking the actions that we are taking. And then in Western State, we have 3 total cases additional, which are 3 new staff. All right, several outlets are calling for a response to the federal lawsuit filed by a couple of folks who attended a church service in Bullock County alleging our orders against mass gatherings violate people's rights to free exercise of religion. Folks, here in Kentucky, there are so many different ways to worship, and all but one church in this Commonwealth are engaged in them. You can do it virtually, and you can do it in a drive-in service. And in many states, they are not allowing those drive-in services like we are. And so this work, this opportunity to worship, which is so important, is still there. We just ask people to choose one of the versions that doesn't spread the coronavirus. And I think that that's what our faith calls us to do. Yes? Well, I think outside our door, we do have a lot of people that have gotten together and are close. We right now, I think that they are out there. Hopefully they are distanced from each other, but still, no one should be engaged in a mass gathering. Well, if there isn't social distancing, they're spreading the coronavirus, and that's really concerning. All mass gatherings we can't be doing. So how much is the state losing each day the economy is shut down? Oh, I mean, the state has a real challenge right now in what's going to happen with our budget. And we have every governor, all 50 right now, that are working on pushing the federal government to make sure that we can get the type of budget help that we need to make sure that we don't take a recession and make it worse. Yeah.
Reporting symptoms, but doctors are not testing them and just telling them to self-quarantine. Is there any tracking of these cases, suspected cases that have not been tested, but are still being told to quarantine as if they have?
So the question is, there are some individuals that have symptoms, but hopefully they are healthy enough in a place where their doctors, without testing, are asking them to self-quarantine, and that's really important when somebody can do that, so that test is available for somebody who is in a more difficult situation. We don't currently have the ability to track that, but what it does say is that there is significantly more of the coronavirus out there than certainly our numbers show. All right, is there going to be an effort or additional steps to make the briefing more accessible to Spanish speakers in Kentucky? All right, since Friday, March 6th, our website, kycovid19.ky.gov, has had a Google Translate option to over 100 different languages. Since March 6th, all of our briefings are on a YouTube channel. They can be turned into 50 different languages. We launched the COVID-19 Spanish website on the 27th. We're working with 2 Spanish-speaking radio stations that broadcast this, or at least a summary of it every day. And a number of other steps that we are taking that we will put out there. Phil.
Is it something that Kentucky businesses or manufacturers can make those?
Right. It's difficult. Dr. Stack, the question is what the N95 masks are made of and why it's so hard to manufacture these here in Kentucky. And we have folks that are working on it, but the materials in them make it a real challenge.
Thanks. Now, I'm a medical doctor. I don't want to misrepresent that I'm an engineer and I design these, but in your air conditioning systems, they have filters that go, in your HVAC in your house. Essentially, the filters that are in these N95 masks are really, really highly refined filters, so they can filter very microscopic little particles from getting into you. So if you breathe and wear these, and I did an interview with Renee Shaw for KET on Monday, and I talked with them as I was leaving. One of their staff was wearing a mask and was commenting how hard it was to breathe through them. And her mask was like one of those painter's masks that was rigid on the front, but it was not sealed all the way around. So these N95s had this very, very finely refined material that's hard to manufacture, so you can't just do it in a regular factory. And when you wear it, you have to be fit tested for it, so there is no air that gets around the outer seal, and then you're essentially breathing through the filter itself, and it's very hard and uncomfortable to breathe through that for hour after hour. But we can't manufacture them because the material that's the filter material is really highly specialized and requires special machines and special fabrication techniques.
All right. Is the governor aware that stimulus checks can be seized by private debt collectors, including banks, and thus not get to the people they're intended to help? If that's accurate, we need to take some steps to address it. We need to make sure that people have these dollars right now to help in the challenge they're going through. Joe.
The regional partnership with Ohio and Indiana, I noticed Tennessee isn't on there, and then we have the longest border. Why is Tennessee not on there?
So it's a good question. It's when we talk about the regional partnership or collaboration, we have Indiana and Ohio, but not Tennessee. And that's because the steps that we have taken and the time that we have taken them has been very much in line with Ohio and Indiana. And I've got a personal relationship there with both governors, having known one when we were attorney generals, to where the lines of communication are just really positive. And we all know we share the same commitment. That's not to suggest that Tennessee might not, but this is the partnership where we know that we can share knowledge and share resources and that the partnership is working. All right, Amazon notified employees at the Lex 2 facility in Lexington on Tuesday of another confirmed COVID-19 case at the facility. Given the company's designation as essential business, it's what steps are going to continue. So we have new guidance from the White House on essential businesses and the different steps you take after people test positive. So the job is for the local health department there in Bullitt County and in Fayette County to make sure that those guidelines are being followed within that facility.
I have a question.
Sure.
Serology test.
Yes.
Did you say the serology test will be made available first to healthcare workers? And do you know the timeline?
So this is about the Louisville partnership we announced. I'm not sure about the overall numbers, but yes, healthcare workers in all the major hospital systems are going to be tested first. The goal there is to make sure that when people come in and are sick, they may or may not have the coronavirus. Those that are taking care of them don't have it, and that also we're protecting those that protect us. I'm reaching out to find out whether or not nursing centers are able to move residents to other facilities due to the COVID-19. So nursing centers, nursing homes are all different. Some may be with very fragile folks, and with those we may have to do a major move like we did in Trayton Oaks. And Trayton Oaks is a facility that's always been rated very high, but the folks are so fragile that we made that move, but still a lot of folks have been lost from that facility. Other facilities could be assisted living, and in some of those, a separate COVID wing may be the very best place for folks to go because some of the same people can take care of them. So it's a very complicated process that Dr. Stack is directly involved in how we respond to each and every one of these nursing home outbreaks.
Protesters aside, lawmakers have been talking about why abortion providers have been allowed to continue operating and providing those services. So I ask you that question: why is that considered essential?
At this point, I'm not doing politics. I'm not in any divisive issue. I'm focused solely on the coronavirus, and all decisions upon what is an elective procedure or not are made by the healthcare professionals. I've had zero input on those decisions whatsoever. Folks, you gotta drown out the politics. And there's a lot of politics with the legislature back in session. We can't be divided. People are dying, and we got to make sure that we protect those around us. It's just us against the coronavirus. Can I confirm whether there is any way that a new Kentucky resident who lacks photo ID can obtain one through the state at this time? That's a really big concern. All of our clerk's offices are closed, and at the moment it would be incredibly hard to get a version of an ID that you could present at the polls. Phil, you get the last question.
Tennessee's governor has announced that there will be protesting for anybody about 22 inside, even those without symptoms. Is that a possibility in Kentucky as well?
The question is there a possibility of testing for anybody who wants one at multiple sites across Kentucky? Yes, there's a possibility in the future, and we're working to get there. When you look at where we are in testing now versus where we started, with what U of L and Gravity Diagnostics and everybody else has done, I mean, starting next week, we're going to have 4 separate mobile sites with one partner. We're going to have an extra 2,000 kits a day going out to hospitals, and that's on top of what U of L and UK and all the private labs are doing. So we are seeing a significant increase in our testing capacity, and what I'm excited about is it's homegrown. It is what we have done right here in Kentucky. All right, folks, I know that tonight probably sounded a little bit different, but we cannot step back one moment for what it takes to protect each other. Now, not everybody is going to be on board all the time, but your actions, what you do each and every day, how we respond, how we protect each other, the type of neighbor that we are going to be is going to depend on how many people we lose to this coronavirus. I want to end by putting up the COVID Act Now slide, just so that we remember as we go what we're fighting for. Those that don't want any of the restrictions are willing to file lawsuits against them. That's the limited action. That's not the poor action. The no restrictions is the 47,000 deaths, at least as predicted under this model. If we don't do our job, if we don't all sacrifice, that's the 13,000 deaths. But if we continue to do what we're doing, we stay strong even when there's noise out there, that we make sure that we pass this test of humanity, that's how we get to that small number. We are in it together. There will always be people who object, but we are more united than ever before. I'm proud to be your governor. I'm going to continue to do the right things, and I know you are too. Thank you all very much. And tonight, we're going to leave you with something the Owensboro Times did, honoring all of their houses of worship that have changed their practices to make sure that we are protecting people out there. Thank you all very much. Thank you, Virginia. Thank you, James. And thank you, Kenneth, who's broadcasting this from home.